Let's talk health. When government prioritizes healthcare, the people are not only healthy, they're alive and happy, and this results in an improved economy. Recently, Nigeria's Minister of State for Health and Social Welfare, Dr. Tunji Alausa, canvassed for a reduction in medical tourism to strengthen the nation's healthcare sector, reiterating the government's commitment to recruiting and nurturing skilled healthcare professionals. However, stakeholders see health entrepreneurship as key to reversing medical tourism by Nigerians and unlocking healthcare value chains. Now, joining us to discuss the importance of healthcare entrepreneurship is Dr. Chijioke Mbelu, CEO, AfriHealth Expo Nigeria Ltd. Hello, Doctor. Thank you so much for joining us.
Yeah, thank you very much. I'm glad to be here.
All right, so can you elaborate on the impact of medical tourism on Nigeria's healthcare sector and the economy?
Well, the impact of medical tourism on our healthcare system and economy is enormous. I can't sit here this morning to start enumerating and counting them. It's quite huge because it affects both the patients and the providers. Because when people are leaving, it's also affecting those taken care of, those who have invested huge amount of money to get medical equipment to see them. So they are losing money. And it's not all the time that those people who travel out there come back better. And to worsen it all, some of them travel to procure or to look for things that could be done here, thereby spending and wasting the scarce resources, financial resources or dollars that we don't have in the country. Okay, spending a lot of money that could have been saved or used here to procure those services they go out there to look for. So it's quite enormous.
So how do you think that, health entrepreneurship can help reverse medical tourism?
Oh, yes. Healthcare entrepreneurship is all about healthcare business. If healthcare business is doing well, small investors will come in. People will want to key into it. People want to put in their money, knowing fully well that they're going to recoup their money. And by so doing, even those outside, that's exactly what happened in India. Back then, when a lot of people, healthcare providers left India, and Indians started marketing, started talking about healthcare business. And investors started coming in. Those that left started coming back. And I see that playing out in Lagos because a couple of guys who have left are now coming back because investors are now putting money. And I think I give credit to the state government. I give credit to the governor and the Commissioner of Health, who is so passionate, because they have tried to make, to provide conducive environment and provided the policies, okay, and laws that encouraged people. Because if the environment is not good, if we don't have adequate policies and laws that will encourage people, then people will not come. Okay, so people are coming back to Lagos today because there is peace, there is security, and the government has also provided conducive environment.
All right, Doctor. Now, speaking about those laws and policies, how can we ensure, retention and development of talent in the sector? Because, we've seen situations where most of our citizens travel out for healthcare, and also, most of our healthcare professionals as well, travel out for greener pastures. So how can we ensure retention and development of talent?
Yes. Another way of doing that, of course, governments have to make healthcare a priority. Okay, by so doing, allocate more money to healthcare in their annual budget. Because if you don't pay people well, for instance, I think that's one other factor, one other reason that makes people leave the country. if you don't pay them well, they will want to go out, okay, to seek for greener pastures. So I think the current budgetary allocation, or let me just say, I'm not sure, but it has been quite poor, quite bad, maybe less than 5%, as against the WHO recommended 10 to 15%. Okay, so if government should allocate more money to healthcare and increase salaries of those working, grant loans, okay, soft loans, grants to private providers, okay, so that their business will now grow bigger and better, and they will be able to pay those doctors working for them. Okay, those young doctors who are working for them, most of them feel bad, and that's why you see them writing exams, and once they pass their exams, they leave. Okay, so if government puts more money to healthcare, and private doctors get more equipment, and teaching hospitals and federal hospitals, state hospitals pay better salaries, I'm sure people will be retained. Nobody will want to go out, because there is no place like home. Nigeria is good. I've been to a lot of countries, and I see even some of our doctors in Canada who have been there for 8 years, 10 years, they have not passed their exams, and they are not practicing. And they're just there doing other jobs. So there is no place like home. So if government should put more money to healthcare, I'm sure a lot of people will want to come back and practice here.
Indeed.
And remain here.
Well, thank you so much, Dr. Mbelu, for joining us this morning to speak on this.
Thank you.